What disease we are discussing today, that is also a neglected disease, and it took almost 20 years for me to get the first case. So after joining Patna, I got not less than 30 cases in 8 months. So this type of cases generally we are getting depending on the region and what type of practice farmers are following. So in Patna, I have observed most of the people are raising 1 or 2 goats, and they are feeding wheat bran and rice, this other grains. So these are the good source of phosphorus, and that's why we are getting sometime outbreak like cases, 4 case, 5 case in every day whenever we are attending the clinics. So this disease is actually a disease of horse. Earlier days, it was considered as a disease of horse, and it has several synonyms like rubber jaw syndrome, cystic fibrosa, Brand disease, Miller disease, big head disease. It is a metabolic disease and mostly characterized by insufficient mineralization of bones, excess bone resorption, improper bone development, and accumulation of fibrous connective tissue. So it is a disease of horse and other equidae. But nowadays it has reported from almost all species of the animal. And in my experience after joining Patna, I have observed so many cases here. So I can say after horse, we are getting more frequently these cases in the goat. So this type of cases are rare in case of sheep and cattle. But in goat, we are getting frequently because goat population is high also and people are rearing. And I have gone through several this electronic data also. There is no report about the sheep, but about goat, there are so many reports. So it affects the special bones which are having high rate of renovation such as mandible, maxilla, and it will develop gradual sourness and deformities. The condition includes decreased concentration of serum ionized calcium and consequent increased synthesis and secretion of the parathyroid hormone. So nutritional osteodystrophy fibrosa is more common in stall-fed young goats. So all cases we are getting that all are from stall-fed. They are not allowed for grazing. So here only one culprit parathyroid hormone is there. So this parathyroid hormone, it may increase either due to primary hyperparathyroidism or secondary hyperparathyroidism. So primary hyperparathyroidism means there will be some fault in the parathyroid gland. So there may be some sort of tumor, some idiopathic bilateral parathyroid hyperplasia. So any sort of problem is there in the parathyroid gland, it is going to increase the parathyroid hormone and it will cause the disease. In secondary hyperparathyroidism, it may be generally due to nutritional imbalance, and few cases of chronic renal disease has also reported. So here cause will be secondary. And this type of secondary hyperparathyroidism, it is very sporadic in nature. So in 20 goats, 1 or 2 may show the symptoms and other may be normal. Nutritional hyperparathyroidism usually affects young animals. Goats having this age group between 2 months to 1 year, 95% cases we are getting from that only. So they are fed with low calcium and relatively high phosphorus content. A secondary calcium deficiency due to excessive phosphorus feeding also occurs. So I have collected some data from internet and some literature are there, like this disease is frequently observed in horse, sporadically described in goats, foxes, pig, dog, reptile, rabbit, guinea pig, cats, lemurs, and budgeriars. Even bird are also affected. And major occurrence in goat fed diet high in phosphorus and low in calcium has observed. And disease can also occur due to continuous ingestion of plants that have high content of oxalate like Cencrus ciliaris, Panicum maximum, Citeria anceps, Branchiera, and Penicitum. So these plants are having high concentration of oxalate and they form calcium oxalate complex, and they are not, then calcium will not be absorbed by the intestine, and that will lead to the decreased level of calcium and it will increase parathyroid hormone, and again there will be more concentration of the phosphorus. So this osteodystrophy fibrosa, some reports are there from southern part of India from Kollam district, 6 male kids in age group of 5 to 6 month old were reported in 1994 and all of them died. In 1995 at Dhoni, 7 male kids were reported of age group 5 to 6 months. And during same period, one report was there from one private owner and 2 male and 1 female kid was found affected with this osteodystrophy fibrosa in Thrissur district. One 2-month-old case was also reported from Namakkal, and report of the occurrence of the condition in northern India is scarce as per available electronic data, but cases are there. There is less reporting about this disease. So nutritional fibrous osteodystrophy was also found in 37 goats, and all the kids were between age group of 2 to 4 months. So at the time of birth to 2 months of age, all of them were normal. And after that, they developed clinical signs like mandibular maxillary enlargement, softening of bones, especially of facial bones, varying degree of mouth opening, protruding tongue, dyspnoea, leg deformities, ophthalmos, exophthalmos, and mastication problem. So out of 37 goats, they have reported exophthalmos in 13 kids, but we have not observed any case of exophthalmos till date. Leg deformities, they have reported in 11 kids. Osteodystrophy fibrosa was also reported in young goats, which received a diet of 60% beet straw and 40% barley for 8 months. So there was disturbance in the calcium phosphorus ratio and it was 1:1.8. So phosphorus concentration was more and that was responsible for the disease. So pathogenesis, it will depend on the causative agent. So if it is due to primary hyperparathyroidism, due to presence of some tumor in parathyroid gland, or maybe some idiopathic, means cause is not known, idiopathic bilateral parathyroid hyperplasia, or it may be due to secondary hyperparathyroidism that occurs sporadically and attributed to nutritional imbalance or chronic renal disease. It affects young animals fed diet with low calcium and relatively high phosphorus content. So excess feeding of wheat bran or grains containing high phosphorus are mainly responsible for nutritional osteodystrophy fibrosa. And here what will happen, there will be excess intake and consequent increased intestinal absorption of phosphorus will cause hyperphosphatemia, which indirectly stimulates the parathyroid gland by producing hypocalcemia. So there will be alteration in the calcium and phosphorus ratio. Normal generally considered is 2:1 and there will be increase in the phosphorus content. So ratio will disturb and 1:1.5, 1.6, 1:2, that type of ratio we are getting. The condition includes decreased concentration of serum ionized calcium and consequent increased synthesis and secretion of parathyroid hormone. So once there is increase in the production and secretion of parathyroid hormone, it will act on bone, kidney, intestine, and it will increase calcium absorption as a compensatory mechanism. So due to movement of calcium from the bone, there will be defective demineralization of bone and there will be imbalance of calcium and phosphorus in the blood and there will be development of fibrous dysplasia. The weakness of the bone predisposed to the fracture and separation of muscular and tendinous attachment. So bone will be fragile and it may break itself also sometime while walking. We are observing typical clinical sign and gross lesions in goat, especially in young animals. They are affected due to their high rate of bone formation and remodeling. Clinical sign we are getting, that is mastication, difficulty in mastication, drooling of saliva, sometimes foaming also, protrusion of tongue, starvation, and death. All vital parameters like temperature, pulse rate, heart rate, they are normal. There will be bilateral swelling of maxilla and angle of mandible, which is hard to touch. So this is the best way to identify a case of osteodystrophy fibrosa if there is swelling, bilateral swelling, and which is hard to touch, and there is no rise of temperature, then we suspect the goat is suffering from nutritional osteodystrophy fibrosa. So there will be varying degree of mouth opening. They will not able to open their mouth properly. There will be protrusion of tongue, drooling of saliva. There will be malposition between lower and upper jaw, severe pain while mastication. Dyspnoea has observed due to enlargement of maxillary bone, which invade the nasal cavity and hindered the airflow. There will be abnormality of prehension and mastication, attributed to the change in mandible, maxilla, and teeth. So there will be very difficulty for the goat to graze. So gradually they will stop taking food, and in 15 days, in a month, they will die. Severity of such lesions may be related to the continuous mechanic stimulus of mastication. There will be softening of ribs which break effortlessly under pressure. Exophthalmos, leg deformity, and death mainly occurs due to starvation. So several diseases we are observing where we are getting the similar sign that of the osteodystrophy fibrosa, and most of the diseases are occurring due to imbalance in calcium, phosphorus, or vitamin D. So nutritional fibrous osteodystrophy should be differentiated from nutritional osteodystrophies develops due to imbalance of calcium, phosphorus, and vitamin D. Besides that, in cattle, mostly we are getting one case actinomycosis. So it is very rare in case of sheep and goat, but some reports are there. We have to differentiate this fibrous osteodystrophy fibrosa from other nutritional osteodystrophies like ricket, osteomalacia, enzotic calcinosis, hypervitaminosis D. So this is first ricket. It is a disease of young lamb and kids. Here the characteristic lesions of rickets are failure of both vascular invasion and mineralization in the area of provisional calcification of the physis. The pathology is most obvious in the metaphysis of the long bone, and it affects generally young animals. So this picture also I got Patna only. I have seen this case. 6-month-old lamb is here, and there is bowing of legs and swollen joints. So mostly clinical sign we are getting pain in bone, a stiff gait, swelling in the area of the metaphysis, difficulty in rising, bowed leg, then osteomalacia. So osteomalacia is characterized by deficient mineralization of bone without a loss of bone matrix in adult sheep and goat. So dietary deficiency of vitamin D or less commonly phosphorus or calcium are main responsible for the occurrence of this disease. Osteomalacia is generally present in mature bones and associated with disruption of normal bone remodeling. It mainly affects adult animals, and this picture I have taken from the internet. So we can see here the unthriftiness, poor growth of the goat. It will exhibits most of the time pica. So it will try to eat everything, whatever he is getting the SS. There will be non-specific shifting lameness. So it will walk on one leg for some time, then it will walk on other leg. There may be chances of fracture of the rib because bone will be very fragile here also. Then one enzotic calcinosis. So this disease is less reported, but few cases are reported from India also. So mainly this enzotic calcinosis, it occurs due to plant poisoning or mineral imbalance. And it is characterized by extensive calcification of soft tissue. It is known to causes of enzotic calcinosis generally comes under the two categories, as I told, one from plant poisoning and other by mineral imbalance in soil. So plant poisoning, some plant are important that causes enzotic calcinosis are Sistrum diurnum, Tricetum, Nirembergia, Solanum species of plants, because these all plants are good source of 125 dihydroxycholecalciferol glycoside. So they are acting like a active form of vitamin D. So they will help in the absorption of the calcium. So there will be more absorption of calcium and it will cause calcinosis of the soft tissue. Clinical signs are stiffness, shifting limb lameness, and it will be more pronounced when animal is sitting and it is trying to get up. Animal will be reluctant to move in later stage. Vitamin D3 intoxication. So it is very rare or not reported in case of small ruminants. So vitamin D3 toxicity is most commonly as a iatrogenic condition. So we are giving some vitamin D3 injection to animal repeatedly, daily if we are giving, or we are giving at 3 or 4 days interval and the dose is high. In that condition, there may be a vitamin D3 intoxication. So here clinical signs are animal become anorectic, there will be loss of weight, animal develop acetonemia within 2-3 weeks after the overdose, there will be tachycardia, shallow breathing, lameness, followed by weakness, recumbency, and even death. So death has also observed with vitamin D3 toxicosis, and this type of cases mostly we are getting in cattle when we are using this vitamin D3 injection to prevent the milk fever. Then actinomycosis, also known as lumpy jaw, it is caused by Actinomyces bovis, that is a gram-positive branching filamentous bacteria and mainly occur in cattle and very rare in sheep and goat. It mainly enter in the bone or soft tissue through oral abrasion. So if there is any sort of wound is inside the mouth, from there this bacteria may enter. So clinical sign mostly observed is immovable, hard, painless, bony mass on the mandible in initial stage. So if you will touch it, it will be very hard to touch and most of the time it will circular in initial stage. In later, there will be formation of fistula and there will be discharge of pus. So here generally we are getting this mass, hard mass in the mandible. And in osteodystrophy fibrosa, mostly maxilla is affected in initial stage and mandibular angle is affected. So diagnosis of osteodystrophy fibrosa, it will based on the history of young age, feeding of phosphorus rich diet, enlargement of mandible and maxilla. So we have taken one X-ray here in picture. So a radiolucent mass filling the maxillary sinus indicate poor mineralization of the bone. So in mandible region, we can see just in front of the teeth, there is poor mineralization condition. There will be swollen face and pouching of the cheek. The maxillary sinuses of both sides filled with moderately soft uniform size mass of tissue. There will be widening of palate, showed mal opposition between the lower and upper pair of the teeth. Loosened and displaced teeth from the socket will be present there. Teeth are loosely embedded in the mass of tissue and palate will be enlarged. So due to malposition of the teeth, it is very difficult for the animal to take food. Some biochemical examination that can commonly done is estimation of the parathyroid hormone, phosphorus estimation in serum. So phosphorus normal level is generally 5 to 7.3 in sheep and goat, and if it is more than that, we can suspect this. Then alkaline phosphatase activity, if it is more than 387 unit per liter in sheep and goat, we can suspect there is involvement of some bone disease. Then there will be decreased level of serum calcium, that is less than 9 mg per dl. So whenever there is high rise of phosphorus and decrease in calcium level, then we can suspect and swelling is there. It is a confirmed case of the osteodystrophy fibrosa. So on necropsy finding, there will be bilateral enlargement of maxilla, mandible, loose teeth, a part of multiple incomplete rib fracture, severe diffuse proliferation of loose connective tissue surrounding the osteoid trabeculae, which may be partially or completely non-mineralized. On histopathological examination, there will be imperfect ossification. Tissue constitute mostly predominantly of osteoid mixed with fibroblast and collagen. In the parathyroid, chief cells are responsible for secretion of parathormone, and there will be hyperactivity of these cells, and there will be hyperplasia and hypertrophy of chief cell. Basic pathological changes in bone, there will be hyperactivity of osteoclast cell with adequate formation of osteoids, but without proper mineralization and osseous transformation. So treatment for primary hyperthyroidism means if gland is involved itself, then there we have to go for ablation or surgical excision of altered gland tissue. And here treatment consists of either ablation or surgical excision of abnormal parathyroid gland. Radiofrequency heat ablation can be performed when abnormal parathyroid gland tissue can be identified ultrasonographically. Then besides that, they have to infuse calcium gluconate to maintain the blood calcium level from 7.5 to 9 mg per dl. Feeding of high calcium diet and supplementation of vitamin D3 therapy correct these serious post-operative complications. In secondary hyperparathyroidism, most of the condition we are getting secondary hyperparathyroidism. Treatment option, one more condition there is renal secondary hyperparathyroidism. In secondary hyperparathyroidism, so here if cause is due to involvement of renal disease, so we can go for the dietary modification, administration of calcitriol in combination with oral supplementation of phosphate binder in management of underlying renal disease. If it is a case of nutritional osteodystrophy fibrosa, one report has suggested treatment protocol for 3 weeks, which include calcium gluconate supplement, phosphate binder, vitamin D supplement, and anabolic steroid supplement. So we have also treated several cases here. We have used phosphate binder. For goat, it is not available. I have tried from this preparation for dog. Sevilemar carbonate, 10 mg per kg body weight daily. Injection vitamin D3, 10,000 international unit at weekly interval, and calcium supplement tablet at the rate of 10 mg per kg body weight orally daily for 4 weeks. It was found quite effective in treatment of osteodystrophy fibrosa. So how to prevent and control? So goats should be provided with balanced ration if they are stall fed. Otherwise, we should provide free access to the goat for free range grazing. Rich source of phosphorus like wheat bran and other grain containing feed stuff should be avoided. Oral calcium and vitamin D should be supplemented in the diet. So we have treated many cases here, but I have selected 2 cases from the same owner. One was having 8 month age, one was 1 year old. From the same flock, we are presented to college with complaint of excess salivation, swelling in the face, and very low intake for last 15 days. So here, most of the time, what happened? These goats are taking little bit of food up to 15 days, 20 days of swelling. So owner generally neglect to come for treatment. So when they stop taking food or taking only water, then only they used to come. The detailed nutritional history revealed the feeding history of more than 30 gram of wheat gram and bread daily for last more than 5 months in both the cases. Clinical observation showed bilateral and symmetrical enlargement of face, especially of maxilla, protruded tongue, foaming, varying degree of mouth opening. normal rectal temperature, and no lesions on mouth examination. So inside the mouth or outside the mouth, there was no lesions and swelling was hard to touch. Hematological examination showed normal values of all hematological parameters, and in both cases there was high rise of phosphorus and decreased level of calcium. Radiographic examination of maxilla and mandible showed the demineralization and lysis of the bone. So same treatment protocol I followed, and Sevilemar carbonate at the rate of 10 mg per kg body weight I have given daily for 4 weeks. Vitamin D3 60,000 unit at weekly interval. So both the goats were 14 kg 15 kg body weight, and calcium supplement tablet 10 mg per kg body weight for 4 weeks. So these all goats showed gradual recovery, but all of them recovered after 25 days of the treatment, and they started taking normal food and water, and till date they are normal. So we can conclude this topic as nutritional fibrous osteodystrophy usually affects young goat fed diet with low calcium and relatively high phosphorus content. Main clinical signs observed in kids or goat are difficulty in mastication, drooling of saliva, protrusion of tongue, bilateral swelling of maxilla and mandible. Nutritional fibrous osteodystrophy may be diagnosed based on the history of feeding of grain-rich diet, young age, clinical sign, and estimation of serum level of calcium, phosphorus, and vitamin D3. It may be treated with dietary modification, administration of vitamin D3 in combination with oral supplementation of calcium and phosphate binder.